All right, time for the next video update. So I wanted to share something I forgot to mention in the last couple videos, a funny story from Friday, our great update appointment on Saturday, and then possibly how surgery went this morning. Today's Sunday. That might be a separate video depending on how long this one goes. So first thing that I wanted to mention is that for those of you who might be going through this, I did have to get 2 steroid shots. So I got one on Thursday. I was supposed to get the second on Friday, but we forgot. So I got it on Saturday during the checkup. And it is not the most fun shot. It is painful, but it's not painful for long. It's a short period of pain. And it is a steroid to help Leo's lungs. And it's essentially just like, worst case scenario, if he had to be delivered really early, it would help his lungs be developed a little bit better and a little more resilient if he had to be delivered super early. So that's why they give that to you. Usually you have 2 within 24 hours. I had one Thursday night and then I had one on Saturday morning because we forgot to do it Friday morning, which was fine. I did not mind having a day break in between those 2 because you also have to get the shot in your butt and it hurts. So that was the first thing I just had forgot to mention. The other thing is my regular OB called me on Friday at like 5:30, and she's the one who originally, was checking my blood to look for these antibodies, and she sent the referral to the high-risk OB, and she hadn't really heard anything. And so Friday at like 5, she just gets like 30 pages of faxes on me from Abbott. And so she calls me and she's like, "Hey, Amanda, it's Dr. Meath." And I'm like, "Oh, hi." And she's like, "I just got 30 pages of faxes on you. What happened?" And so I gave her the whole rundown, what happened on Thursday, how surgery went that morning. And we were just kind of talking about it. She was really kind and just really wanted to check on me and see how I was doing and see, what my appointments were like with the Midwest Fetal Care Center. And she was like, "I have been in practice for over 20 years and I've never had a patient whose baby had fetal hydrops, which is that fluid." So like, that's how rare this is. Like, she's never had a patient that was this anemic. And it just goes to show, like, this isn't normal. So I wanted to also like touch that, because if you just have antibodies, it does not mean you are going to be in this like emergency 3 transfusions in a week mode that we're in right now. A lot of the stories that I've looked at are like, they found the antibodies and so they just had more ultrasounds. They just kept checking that vein in the brain. They kept checking for fluid, and baby was fine pretty much the entire time. Sometimes baby became slightly anemic right before delivery, so they just delivered a little bit early. Some of them maybe had one of these transfusions after delivery. The situation we're in is like very abnormal. So I just want people to not think that this is like, just because you have antibodies means that this is what you're gonna have to go through. So anyway, she was like, this, I've never even had this. And I was like, well, when I delivered in Waconia 3.5 years ago, the entire hospital also had never had a infant with their femur break on the way out of delivery, which is what happened with our daughter. So I was like, I guess I'm just here to bring the anomalies to you. And she just laughed and she was like, "Oh my gosh, that's so true. Also, please tell me this is your last pregnancy." She was joking, but I'm like, yeah, I'm feeling done right now. I'm feeling like once we get through this, I don't think I'm interested in doing this again. We're good. We'll get Leo out nice and healthy by the grace of God, and we'll be good with our 2 beautiful earthside children. So that's the first chunk. And so we landed on my last video was how Friday went. And that was our first surgery. Quick rundown of the stats again. He started at 9.9% red blood cell count percentage. We got him up to 19% after Friday's surgery. And so Saturday morning is where we're at next. And that was our first follow-up appointment. So after every surgery, we have a follow-up ultrasound the next day just to make sure he's doing good, make sure he took the transfusion well, that we're all still like in the clear with the plan. And so Saturday morning we went in 8 a.m. It was a quick appointment. Doc just did the ultrasound himself, came in, and he was really pleased. Leo did really, really well. He was moving around. He was feeling good, it seemed. He was feeling better. Even just getting to 19% red blood cell, he could already see the fluids coming down. So that was really encouraging. And then his, that vein in his head, which I can't remember if I corrected this in the last video, but the test is called MCA and the measurement is MOMs. I'm still trying to get all this terminology correct. So he checks the skin and the stomach and the heart to check to see if the fluid's coming down. It was coming down, so that was great. That's what we wanted to see. And then he checks that vein to do that MCA measurement, and that's how fast the blood is moving through the vein. And quick reminder of those stats, on Thursday when we went in, it was 2.4. Normal is 1, anemic is 1.5. He was 2.4. So that was the other thing that sent off all these alarms, like he's super duper anemic. And so from just Friday's transfusion on Saturday morning, his MCA test, so his MOM measurement, hope you're following this, was 106. So obviously still anemic, but significantly better than 2.4. So we were thrilled about that. So Saturday morning was really good. We were feeling really good that he took it well. Obviously, you know, the biggest concern on Friday morning was whether he was going to take the transfusion at all and if we were even going to make it through the day. And so being able to go on Saturday and be able to see that he was doing really well, that he took it great, his fluid was coming down, you know, his number there was coming down, was really encouraging. And the more transfusions we do and the more the fluid goes away and the slower that gets, just the safer zone that we're in. Because the biggest issue right now is just all the fluid around the organs. We have to address that first, because that would cause the organ failure. And the more red blood cells we can get, red blood cells carry the oxygen to the body, so that helps that. Once oxygen gets everywhere, then the fluid can back off. So less sick. So that's important. So that was Saturday. Feeling really good after that. Really grateful. I think I'm just going to go ahead and make a separate video about Sunday because I want to make these semi-short. But I can just record that right after this. So I'll post this one for sort of our notes, a couple things I forgot, and then our Saturday experience. And then Sunday was scheduled, second surgery, second transfusion was scheduled on Sunday. So I'll make another video for that. So anyway, thanks for watching. I hope that you are enjoying this story. And I'll see you later.